Welcome to the module on food allergy and allergy relief. In this module, we will be learning about the various allergens in food, the allergic reactions they cause in the body, and the remedial measures for the same. Allergy is a hypersensitivity disorder of some kind of immune system of human body. Allergy reaction, it is nothing but when the body's immune system reacts abnormally to a substance which is present in the environment. The substance causing allergic reaction is called allergen. The overproduction of specialized antibodies called immunoglobulin, that is IgE, by immune system are responsible for producing allergic symptoms. The proteins which are highly responsible for allergic reaction are especially found in eggs, peanuts, seafoods, cow's milk, soya, wheat, etc. The presence of very minimal quantity offending food causes very serious allergic reactions with individuals who are susceptible for specific allergy. Food allergy can develop any age, but the prevalence is common among children below 5 years. After going through this module, you will be able to understand what is food allergy, what are the immunological response to allergic reaction, explain the effects of food allergy on health, and what are the dietary principles to be followed during food allergy. Let us now look at the phenomena that causes allergic reaction in an individual after consumption of some kind of food. We will also learn the difference between food allergy and food intolerance. 2000 years ago, the adverse reaction towards milk was reported by Hippocrates. Food allergy is the immunological response after consuming certain type of food leading to the production of immunoglobulin E antibodies in our body. So, the food that induce overproduction of this kind of immunoglobulin E antibodies are called allergens. This we discussed already. The specific immunoglobulin E antibodies are produced by some atopic individuals against certain allergens in food, which in turn binds with the mast cell or basophils. The second exposure of such allergens results in binding of allergen with immunoglobulin E, leading to degranulation and release of certain mediators which cause various allergic reactions such as diarrhea, asthma, rhinitis and eczema, or even severe systemic reactions leading to death. Immunoglobulin G response to food is projected here. Food allergy should not be confused with food intolerance. Food intolerance does not involve the immune system. The food intolerance is defined as the abnormal physiological response to the ingested food which creates a metabolic disorder in our body. Traditional system of medicines describes certain foods that cause pitta, vata or some kind of cough are to be avoided during disease conditions. Let us discuss about some of the common symptoms that can be observed due to food allergy. The following are the symptoms that are associated with adverse allergic reactions, that is itching in the mouth, swelling of the tongues and lip, gastrointestinal symptoms like diarrhea, vomiting, pain in the abdomen and some kind of cramps, eczema, difficulty in breathing and tightening of the throat, finally the decrease in blood pressure. Having studied the symptoms, let us now look at the types, that is group of major food allergens. The clinical feature of important allergens are explained to provide relevant information for the management of food allergies. It was estimated that globally around 2.5% of infants are affected by cow's milk allergy, whereas 34% of the children in the age group of 3 to 5 have intolerance to it. The allergic reactions towards milk allergy are caused by immunoglobulin E mediated or cell-mediated origin. Substitute for the milk allergy with sheep's milk or goat's milk cannot be done because the children reacts to these kind of milk as well. The immunoglobulin E antibodies are triggered by the proteins present in cow's milk like casein and whey protein. It was found that children who are allergic to cow's milk have higher risk for developing other type of food allergies, and it is an inhalant allergy also. Allergic reactions are not life-threatening to infants and children. Approximately 2.5% of children and infants are allergic to hen's egg, and tolerance towards this is achieved only after 5 years of age. The protein which is responsible for allergic reaction in hen's egg, it is found in the egg white. Children who develop this kind of allergy to hen's egg have greater risk of developing respiratory allergens in later part of life. Allergic reactions are not life-threatening, but studies also reported death due to egg allergy. Among the egg processing workers, sensitization occurs by inhalant route. Peanut allergy is common among adults with the symptoms of asthma. They'll have some kind of respiratory problem. So individuals should be precautious because even the small traces of this protein in the processed food are problematic, and they are advised to avoid the refined peanut products and some kind of oils which are based on this peanut. Soybean is reported for both immunoglobulin E and cell-mediated allergic reactions, having clinical manifestations in infants and young children. But processed soybean oil is well tolerated by persons with allergy. Finned fish allergy is potentially very severe. The allergen found in finned fish that is responsible toward allergic reaction is parvalbumin. So, similar to this finned fish, allergen found in crab, shrimp and lobster are also very severe. Tropomyosin, a muscle protein, is responsible for allergic reaction, which is also found in some kind of invertebrates like insects and cockroaches. Life-threatening immunoglobulin E mediated allergic reaction have been reported when some seeds like cottonseed, caraway, fennel and coriander are consumed. So, there are reports on certain allergic symptoms to sesame, sunflower and mustard seeds. The most common food allergy, that is immunoglobulin E antibody mediated one, in adults is reported due to fruits and vegetables. Symptoms occur predominantly in oral cavity due to sensitization to pollen grains. This type of allergy is called pollen food syndrome or oral allergy syndrome. Reactions to fruit have been associated with the presence of immunoglobulin E antibody to specific protein called lipid transfer protein, or it can also be called as storage protein, that are sensitized with specific allergen called profilin, leading to some kind of gastrointestinal symptoms. Increasing population needs a greater demand for agricultural stuffs. To meet the demands, many commonly consumed foods are produced more in quantity by altering the gene, which is called as genetically modified foods. These transgenic plant foods could cause severe allergic reaction because of the presence of endotoxin. These endotoxins could also lead to anaphylactic shock. Apart from natural foods, some food additives also induce adverse allergic reaction in certain individuals. Now, let's take a look at some of them. Food industries are using number of additives. Few additives are involved in immunoglobulin E mediated reactions. Adverse reactions to food additives are very rare, but they are severe. The additives are used by food industries by the purpose, that is for flavoring, preservatives, thickeners, sweeteners and as a coloring substance. Here I want to say additive is a non-nutritive substance, but it is added just because to enhance the flavor, texture, color or the overall acceptability of the product. The symptoms caused by the immunological or non-immunological reactions after consuming foods that contains additives are anaphylaxis, asthma, angioedema, etc. These reactions may become life-threatening and can be fatal. Some of the additives are nitrates, monosodium glutamate, sulfides, benzoates, butylated hydroxyanisole, tartrazine, parabens and sunset yellow. Monosodium glutamate, it is a non-essential dicarboxylic amino acid which is added to the food by the food industry and even by many homemakers just to enhance the flavor predominantly among Asians. So, frequent use of this additive has been known to create adverse reactions like backache, nausea, tingling, flushing, chest heaviness. This chest heaviness is called as Chinese restaurant syndrome, and monosodium glutamate has been involved to induce asthma in few subjects. So, one has to be careful in using this monosodium glutamate. Let us now understand the clinical terms as to what are the actions and reactions that exactly takes place in our body after the ingestion of certain foods by certain individuals. There are many variations and we shall study them brief. A wide spectrum of adverse reactions may occur after the ingestion of food. These are typically classified on the basis of the underlying pathogens. Adverse reactions or adverse food reactions can be divided on the basis of immunological and non-immunological mechanisms. These are the conditions that are associated with immunoglobulin E mediated reactions to the food. There are certain methods that are used to ascertain whether an individual is allergic to certain type of food. Some of the techniques are: the food needed to diagnose food allergy are food history, physical examination, skin test, skin puncture or prick test, X-ray, basophil histamine assay, serum estimation of specific immunoglobulin E antibodies, elimination diet, oral food challenges. Now, let us see one by one. Food history, it is a detailed history. It is very much important to determine the food that cause allergic reactions and also to identify the specific immunologic pathway. Diet records are also very essential to determine the same. The presence of atopic disorders like atopic dermatitis, asthma and allergic rhinitis can be determined by physical examination so as to indicate the increased risk of food allergy. This also helps to identify the alternative treatment to be taken to prevent the food allergy. In intradermal test, a minute quantity of the extract containing the suspected antigen are packed into the skin over the arm. Whereas in the scratch test, a small amount of antigen solution is applied to the series of scratches made into the skin and it is noted for allergic reactions. In the patch test, the antigen is applied to a piece of filter paper over the skin and covered with the cellophane tape for 24 hours, that is for 1 day. If there is any red inflammation or hive-like wheal appears at the site of the contact, the food is suspected to contain allergen. This is a very simple test. Sometimes edema due to vasodilation also occurs. Specific immunoglobulin E antibodies can be analyzed by skin prick or puncture test and also by analyzing the serum values of it. These tests are highly sensitive but are specific and hence cannot be used for screening purpose. Intradermal or intracutaneous skin tests are potentially very dangerous and they are not advised for the diagnosis. Results of skin prick test and serum test for immunoglobulin E antibodies are influenced by age, reagents used and the techniques applied. The aim of this test is to measure the binding of immunoglobulin E to specific allergen like egg, milk, fish, and finally the score is given from 0 to 4. The patients who respond to allergic reactions have the score of greater than 2. Changes in the smooth muscle spasm can be identified by X-ray after the ingestion of suspected food mixed with barium sulfate, but this shows only the abdominal distress after food intake. Basophil histamine assay, it is an assay to measure the release of histamine from the whole blood. So, basophils that are exposed to various food antigens and can be used for testing immunoglobulin E mediated food allergy. Higher concentration of immunoglobulin E antibodies are directly related to increased risk of clinical signs and symptoms of allergy. Hence, serum estimation of immunoglobulin G antibodies are essential. Elimination diet helps to identify certain foods that are involved in causing symptoms and worsening the condition by eliminating the specific food in the daily diet. The steps involved in elimination diet are planning, avoiding, challenging and tailoring a new diet. A elimination diet may be helpful to determine if a disorder with frequent or chronic symptoms is responsive to dietary manipulation. Trial elimination diet can be practiced in children and infants because they consume few varieties of food and the symptoms can be observed or monitored easily. But this type of elimination diet, it is very difficult to be followed or monitored in adults because they consume wide variety of food. Elimination diets can be practiced only in the hospital sectors with the cooperation of a dietitian or with the physician. Graded oral food challenge is the one of the way to diagnose adverse food reactions. So, this is also helpful for the diagnosis of food allergy. Having looked at the foods causing allergy and their symptoms and the test methods, let us now investigate how it can be avoided or how it can be managed without any pain for the susceptible people. The principal management to avoid food allergy is to eliminate the food that causes allergy from the diet and that causes allergic reactions. Following an elimination diet continuously may lead to malnutrition and effort should be taken to meet all the nutrients for the subjects following elimination diet. The caregivers should be educated in such a way that elimination diet meets all the nutrient requirements. After identifying a specific food allergy, the food causing the allergic symptoms should be avoided completely from the diet. Successful avoidance of food allergens, it is based on the following criteria. Let us see the criteria. That is, identifying the allergen that causes the allergic symptom, recognizing the cross-reacting allergens with other foods, educating the caregivers on hidden food allergens like additives, genetically modified foods, etc. Both the patient and the caregivers should inquire about the allergens present in the food while eating at the restaurant or at home and to check the ingredients before purchasing the food. Knowledge on how to prevent inadvertent exposure of specific allergens. Intolerance is different from allergy. Though it may be less severe in nature, repeated consumption of some type of intolerant food may lead to complications. Some of the foods and the allergic reactions they cause are projected here. Consumption of fish, dairy foods, chocolates or any kind of cocoa product, egg, yeast, citrus food, food colors, nuts, preservatives, chicken and beef, it may create some kind of rashes and eczema. Intake of egg, wheat, azo dyes, milk, sodium benzoate, sulfur dioxide, monosodium glutamate, sodium bisulfate may lead to nasal polyps, rhinitis and asthma. Food additives, cheese and chocolate, which is a rich source of vasoactive amines, citrus fruits and foods that contain yeast may change the behavior of an individual and it may lead to migraine also. Sucrose, fructose, lactose, cow's milk, barley, oats, wheat, yeast, dairy products, corn, consumption of these kind of things may lead to abdominal pain, vomiting, diarrhea, infantile colic, malabsorption, Crohn's disease, irritable bowel syndrome. And intake of milk, cheese and any other milk products, cereals and whole fruits may lead to inflammatory disorders like arthritis. Food allergens are always inherited and identified at early life. Compared to adults, infants are more likely to have food allergies that are identified at the age of 3. The changed reactivity can be due to the decreased absorption of immunological food proteins as the intestinal mucosa and the secretory immune system mature. Denaturation of protein has shown the beneficial effect in elimination of food allergies. For example, the person who is sensitive to raw milk does not show the allergic reaction when the boiled milk is consumed by the same person. Subjects who are allergic to egg white are advised to take only the egg yolk because egg white is the main allergen that may create problem. Subjects should avoid the particular food with allergen at least for a period of some short time and then start gradually with a great caution. The patient should inform the physician about the offending food before the treatment starts. To conclude, prevention of food allergy is better compared to the complexity of diagnosis and its treatment. It has been found that neither the immunotherapy nor the oral desensitization has proven successful in the prevention of allergic reactions to the suspected food. Not all the adverse reactions to the food are considered as allergies. The adverse reaction after consumption of monosodium glutamate or lactose are said to be food intolerance as they produce no antibodies after consumption. On the other hand, complications due to food avoidance leads to growth retardation and some kind of vitamin or mineral deficiency and muscle impairment. Hence, identifying foods that leads to allergic to an individual as early as possible and its avoidance is of paramount importance.